Hi, Dr. K.
Hi.
Welcome back. The
Thank
FAQ
you.
style, right? Are you excited to be back?
Yes, very
Yeah.
happy to be back.
It's been a while.
I know, guys.
So now we're going to start with something a little bit light, but it's still not like openly discussed enough. Ne?
Okay.
So we're starting with menstrual health.
Okay.
So my first question for you is that is it normal to experience extreme pain during periods, or could that be a sign of something more serious?
Okay. So experiencing extreme pain during your periods is definitely not okay. It could be a symptom that something is not going well, especially if the pain doesn't respond to simple analgesics, so simple painkillers like Brufen. If you need more than just that, then maybe you need to see a doctor for your period pains. But pain that doesn't stop you from functioning and doing your everyday activities is acceptable. But once the pain, you can't really function, then you need to see someone for it.
Okay. And then the second question is how do I know if my irregular period is linked to stress or something like PCOS?
Okay, so for us to investigate or for us to try and find the cause of missing your periods, you need to miss your periods for at least 3 to 6 months, depending whether you have a regular cycle or not. So if you're someone who has a regular cycle, missing your periods for 6 months or more, then we could start thinking maybe it could be PCOS or other things. Because remember, stress is not always there. So if you're missing your periods for more than 6 months, then maybe there is an underlying condition, unless you're telling me that you've been stressed for the past 6 months. So we look at the duration and then take it from there.
Okay. And then the third one, what should someone do if they can't afford pads or tampons regularly? Are there any safe alternatives or something like that?
Well, I think you could consider using reusable pads. There are people who sell them. I think that's what you could use. But other than that, there
So
isn't
it's
really
the
much.
pads that you wash and oh,
I
okay.
don't think I'd want to wash my own pads, but
Yeah, yeah, makes sense. Okay. And then the fourth one, can birth control really help regulate heavy or irregular
it
periods?
can. Birth control can help regulate heavy periods if you are going to choose something like combined oral contraceptives. Remember, the goal is to try and mimic what would happen in your cycle naturally. So your patch is also a good option if you want to regulate your cycle or make it less. The Mirena, the loop, which is the progesterone containing loop, is also a good option if you're someone who has heavy and painful periods. So it can be a good alternative.
In the public sector, do you need to have any symptoms for you to get an STI screening? Or you can just go there and be like, hey, I need a full STI screening.
Well, you can go and say, I need the screening. You don't really have to have symptoms, but most people will come to us when they have symptoms, obviously, but you don't need symptoms. Like Bonolo was saying, when you enter a new relationships, like, why are we not testing?
So it is a myth that you need symptoms or
No, you can. And also remember, some STIs don't have symptoms. So we can test, but you might be having, I don't know, HPV and you don't have symptoms until we do your pap smear and actually see that, okay, you actually have HPV.
Okay. Okay, another question. That was a deep one. Another question. Why do so many people only test after things go wrong? I think that's what you were asking now, ne?
Yeah, I
What
think
needs
so.
to change in our mindset?
I think we need to change the way we think about STIs. We need to change the fact that I'm only going to test when something goes wrong. We need to make it a routine, like how every year I must see my gynae and check that all is well. Even with STIs, the same thing must happen. Like when you enter a new relationship, like I don't know where you've been, you also don't know where I've been. So I think the best thing to do would be to test for STIs. Even when a relationship ends also, why must we test when the relationship starts? So I think it's how we look at it. We want to test because there's something wrong, but maybe we should test because it's part of your sexual health. It's part of your whole well-being.
Okay, and then the last one for this segment is that is there such a thing as testing too often, like testing too much? So basically, or should it be like a routine, like you're going to a dentist
I
or going
think
to
so. Like, why would you
optometrist?
test? I don't know, but yeah, if you're gonna have a new relationship every month, then maybe you should test every month. I don't know, but yeah.
Okay. What should a woman do if both her and her partner test positive for gonorrhea, but he refuses treatment and won't use a condom? Because I remember the last time you said some STIs need like treatment for both partners. Yes.
Okay. So in my own personal opinion, all right, take away the fact that I'm a doctor. I don't think I would want to be in that relationship, number one, because it's really pointless treating the partner and forgetting about the other person and still refusing to use condoms because the gonorrhea is never gonna go away, all right? And remember, it could be gonorrhea today, but sometimes the infection can move up your womb and then you have an infection that affects your whole pelvis. Right, it doesn't just stop with gonorrhea. You could have infertility because you had an STI that was never treated. So I personally think choose yourself, get treated, and like honestly move away from that relationship.
Okay, interesting.
Definitely.
Uh, second one is what should a person do, an individual do, if they find ARVs that were hidden or are hidden in their partner's room and that person hasn't disclosed their
Ooh,
status?
guys, hey,
How would you advise there?
I think that's a difficult one because ish, disclosure must come like voluntarily when the person is ready to disclose. But then you can't, if I haven't put you at risk, if we've always used a condom, if I haven't exposed you in any way, I think I wouldn't be, you shouldn't be mad because you are angry on what basis? At the fact that the person is HIV positive and decided not to tell you.
Maybe they're not angry at the fact that they're HIV positive. They're angry that they didn't disclose.
I'm not ready to tell you. What if I'm scared that you're going to judge me?
But it could be that you took away
The what?
you took away the decision from me to decide that, okay, I want to be in your life. I don't want to be in your
Ooh,
life.
I can't come back from that. Yeah, guys. So what should happen?
I mean, isn't it advisable to disclose and then you go fully? Because I think also wouldn't be a lie, or wouldn't you be living a lie,
I'm not lying.
or
I don't
working
think.
on eggshells, or the relationship should be treated like an egg because there's something that's not, I
That
don't
you
want to say a
haven't.
secret, but okay, let's just say a secret that is not disclosed. And if you could disclose early, then that person has a choice that, okay, I stay, I choose to be with you, or I don't
Gosh,
choose to be with
guys.
you. Also, we are also trying to
So
destigmatize the.
the HIV thing.
Yes.
Yeah, I don't know. So you're saying the person has the right to be angry because you didn't disclose. And also, like when do we? Okay, I get that when we start dating, we need to have the conversation now, right? As early as possible. But when we then when you then find ARVs in someone's, I don't know, drawer or something, it then not only is this person lying about the fact that they're HIV, and also it could be post-exposure prophylaxis.
Fair. So you need to have that conversation. That,
To us
okay.
that okay, these are ARVs, they are for what? Is it you're HIV positive or you're taking them for post-exposure prophylaxis? Because those are two different things. I could have been exposed before I met you. I could be finishing them off. So I think we need to understand, why does this person have the ARVs? Are they HIV positive? And also, as a partner, like what can you do to support this person if they're HIV positive, for instance? And also, why did this person find it difficult to have this conversation with you? Is it because HIV is still a stigma in like these days, or is it because they're scared of being rejected by you the minute they tell you that, dude, this is the situation? Because I promise you, in as much as we've done so much education about HIV, there's still so much learning that people need to do.
True.
There are still people who don't understand. The minute someone hears that someone is HIV positive, like red flags, this person is gonna give me HIV. Dude, there's you is equal to you, hey?
All right. Then my follow-up question would then be, I'm playing the devil's advocate. Would then be, would you blame the partner for saying, okay, now that we've disclosed, I understand your status, okay, I'm not judging you, it happens, I understand HIV, but then because you denied me the choice to be with you, to support you, I choose to leave you. Would you blame that person?
No, I wouldn't. I wouldn't.